Hi guys, Dr. Shaun here. Hope everyone's doing okay, staying safe. Well, today I'm going to be talking about the differences between bridges and implants and when we use them in certain situations. Okay, so when a patient needs to replace a missing tooth or teeth, I usually give them a couple options. It's usually just either a bridge or an implant. There is another option of placing some sort of removable appliance, but I don't really like that option unless it really comes down to cost. So I usually recommend either a bridge or an implant. And there are pros and cons of both. Now, bridges. So bridges replace missing teeth between two or more teeth. It's usually a two-step process that takes about 2 weeks. So the first appointment is where I go ahead and prep the teeth that are going to be the bridge is going to be holding on to. And the second appointment is to cement the bridge. Okay, so for bridges, you got to make sure that there is going to be basically a retainer tooth on each side of the bridge in order for it to be attached. Now, the pros of bridges is that it's a faster process. It takes usually 2 weeks. One appointment for the prep, second appointment for the cementation. It's usually inexpensive, and we'll talk about it more, but it's usually inexpensive in the short term. Fast, inexpensive, go for it. Now the cons, it's hard to keep clean, especially when you have to floss, because when you have to floss, you have to use a floss threader to get underneath to clean anything out underneath the bridge. Now it doesn't last long due to the fact that the teeth that are connecting the bridge, if one of those get decayed or anything happens to one of those teeth, then you have to redo the entire bridge. And another con, the most important con in my case, is that you have to sometimes prep perfectly good virgin teeth. For example, if there's no fillings or any crowns on the teeth that are holding the bridge, you still need to prep them in order for the bridge to hold on to them. So it's not a great situation for that. Now, for implants. Implants replace the missing teeth. Now, they don't have to attach to any teeth, so you can basically place them anywhere. They can be in the distal of your back molars. It can be placed anywhere regardless of whether or not there's any teeth mesial or distal to the space. Now, for the pros of implants, they're easier to keep clean because you can actually floss between implants and the tooth adjacent to it. You don't have to cut it into any adjacent teeth, so no cutting into any virgin teeth. Now, implants, they last much longer. They're in the bone, they last longer. We usually don't, for the most cases, see them pop out or wiggle themselves out for the most part. And also what implants help to do is they actually help to prevent bone loss because it's basically embedded in the bone, so it prevents any kind of bone loss happening around that area. Now the cons are that it's a much longer process. It's usually a 3-step process, which can take up to 3 to 6 months. So the first step, usually the oral surgeon will place the implant. Second stage, he'll uncover the top portion of the implant and place an abutment, and then let that heal for a little bit longer, and then I do my job of placing the crown on the implant. So it's a long process, but it's definitely, in my case, worth it. Now, another con, it's more expensive, and insurance most of the time doesn't cover it. But in the long run, the implant is more inexpensive because you don't have to change out an implant as often as you have to change out a bridge. So when I explain this to my patients, I really try to get them to do an implant because, yeah, in the short term it's going to be expensive, but if you have to redo a bridge even 2 or 3 times, even 2 times, the implant's going to be much more worth it. Basically, to summarize everything, I always try to persuade my patients to go the route of implants. The only reason I would recommend against an implant is due to poor medical history and the patient is not able to do the surgery, or if the implant site does not have good enough bone quality for the implant to be placed into. But every patient and situation is going to be different, so we just have to make the appropriate treatment plan. Well, those are the pros and cons of bridges and implants. If you have any more questions, let us know here at Burst TV. Thanks, guys. Talk to you soon. Bye.